Hello, everyone. Happy Saturday, and welcome to Power Time. Again, it's a sunny Saturday afternoon in the beautiful state of Maryland, and so we are here today, Sharon Herbert, the Power RN, live and straight to you from Power in Nursing Innovations. And every week we do some updates from the world of nursing. And it's really getting a lot. I will remind you, though, we had a happy last week when we talked about your help is coming. So, yes, your new grads are coming. They are on the way. They are on the way. So, help is coming. In the meantime, we've had lots of news in the world of health care. And so it's not all just about nurses, it's about the system and as well about the world. And we've had tremendous sorrow and hardship that's been posted, and the results of some mass shootings. And that leads us to think about where nurses and the healthcare providers are in the world, but we're circling right back to a huge stressor for nurses and other healthcare providers. It is workplace violence. And workplace violence is a big risk for health providers. And as a matter of fact, the research says, and I'm sure the CDC and other researchers will verify, that healthcare workers are at an increased risk for workplace violence. And the seriousness of the violence also has an effect on the staffing and the available healthcare workers. So we're talking about a shortage already. And if you think it's just nurses, it's doctors too. But if folks are out because they've been injured at work, that's a bigger stressor for the rest of the profession and the system and the patients, etc., the community, and it goes on and on. So healthcare workers are 4 times more liable to be injured in the workplace other than other health professionals, other professionals, not health professionals. So nurses and other healthcare workers are more prone to being injured and out of work due to scenarios leading to workplace violence. And that is a huge challenge. It is. Sometimes things vary by setting, but there are major risk factors that healthcare workers and nurses face. And some of them are external. Lots of them are external, but there are some that are internal as well. So we need to make sure that we know what is going on, what challenges we may face. And do you understand what those challenges are each and every day and in each setting where you are working to take care of someone that you don't know? And you may find that person later has a history of violence, or they're under the influence of some drug that makes them act in a way that's not safe for you and probably not for them either. There are some things that we need to know to look out for. Things like poor environmental design might block your vision or escape routes. And I'm just going to put a hashtag Ted Cruz. If there is one way in or out of the place where you are working, you are already in danger. You are blocked from exiting if an assailant is at the one door to the place that you are working. That is very scary. So think about those things and about the lighting in the hallway and at the entry or exits. Things that are very, very simple to pay attention to. If you are working on a unit, do you have working communications to let someone outside know that you need help? You need to check those things and know what's going on before you settle down to your assignment. And you may be working in a patient's room and something is happening outside. So think about that. How many staff are assigned to the place where you're working? I had a young lady who shared her story just the other day, just the other day, about working, being assigned to work in an, step down ICU. They had 6 patients, and she was the only nurse who was assigned to that unit. All alone is not the place that you want to be. You need to have help available, for one. And even if we are not talking about needing help and an emergency coming, when is it that that nurse gets to eat, gets to drink, gets to go to the potty? If it is a 4 hour, 8 hour, or 12-hour shift, that is danger for that person. It is not safe and it is not healthy. So, working on a unit alone is not where you want to be. What does your security look like? And today, as we're following up on the story of 2 nurses and a doctor who were stabbed in a hospital setting in Encino, California, what do you do? What do you need to know? Where is your security? And folks just get to walk in. It's a public place. I get that. It's a public place. But it seems today, with the number of times in the last 7 days that we've heard about violence in the workplace, from Uvalde to California to New Orleans, and on and on and on. Folks are working, even if they're not health providers. We're hearing that they are being injured in their workplace. Yes, the school is a workplace. And unfortunately, those children were shot, so were the teachers. And that is not where we want to set people to be. But we have to pay attention. And having one way in and one way out is almost as bad as calling out fire in a crowded movie theater. There is no way that people are going to get out of an area safely if there is one exit. So I don't really care what Ted Cruz says, because that was stupid. And it was really stupid. And I rarely use that word, but that was stupid. So think about things that I will share this one moment And I will ascribe this to my good friend, Dr. Sandra Risaldi. And Dr. Sandra, is the founder and president of Nurses United Against Violence. Nurses United, nurses are Nurses Against Violence United. Let me rephrase that and get it right. Nurses Against Violence United. NAVU. Dr. Sandra Risaldi. And she is an advocate for the world of nursing violence. Nurses are, of course, the main focus of angry patients, and we're almost like crabs in a barrel, that they find us, more than one of us together, and that's an easy target. But we need to also know that there's a perception that violence is tolerated and the incidents won't have any effect. Two big red flags. There's a lot of us. We're in the same place. That's the one flag. A lot of us in the same place. And we are women. Uh-huh. And we don't fight back. And we are sad and sorry and can't do anything for ourselves. And we're easy punching bags. I know that was more than two. I know that was more than two. But we've got to pay attention. We've got to pay attention to this workplace violence issue. And we've got to have our antenna up. And don't put your head in the sand and say, well, there's nothing that I could do because, it was a guy and he was bigger than me. We've got to put our brain power behind saving ourselves and our professions, and we're also saving others, other patients. The community is, ooh, will they come to those hospitals now when folks have been shot in the ER and they have their own issues at home? Maybe they have COVID. Maybe they're having a heart attack, or they have diabetes or hypertension and it's raging through their system, but they're afraid to come to the hospital. We've got to do better in this United States of America. I can tell you, I've had a patient's parent who tried to jump out of a window. My patient's parent. And you know what? It was a night shift. The child was deathly sick, a newborn, and the father was stressed. And what happened? Each and every one of my colleagues who were available and the charge nurse came to the rescue of me and my patient. Called the nursing supervisor, security came, but by the time security got to the third floor and the one security guard that was assigned to our unit, we had that taken care of. The doctor was asleep, but the doctor got awakened, came in, but that charge nurse, I will tell you, I won't tell you her name. My friends who were there know who she is. She took care of everything, made sure everyone was okay, and the dad was safe. And the baby actually was okay. Yes, the baby was really sick in the NICU. But we knew what to do. So we've got to take care of ourselves as well. None of us were injured. All of the parents that were in the waiting room where that gentleman was were safely evacuated. We can't put up with any of this stuff in the world. And as I say, It's the bane of our existence is falling. We are falling. We are falling. And we can't afford to be thought of as punching bags because that is not in service to us as individuals or as professionals. And we are professionals. So we've got to pay attention, America, and make sure that the legislation that's sitting on the Congress or the Senate's desk related to safety in the workplace and the abandonment of just having those things sitting on people's desks where they're not going to do anything. So the Senate, they're not going to do anything. Well, that's a problem. Things that we are going to have to deal with. I know we love money, and I know we need it, and we are worthy of it. But if you are not alive, that money is not going to do anything for you. And if we cannot promote the career and profession of nursing, we will slip into extinction. And a robot cannot do what we do. So make sure that you are aware of the challenge in the world. And just think, in Uvalde, if you were a pediatric nurse, what would you have done if you did not have a pediatric intensive care that was large enough to serve that community of the 19 that were shot and killed and the other children that are still in the hospital? It is more than we can bear to have to suffer those stressors as well. That is a stressor. And we're not, I guess, allowed to put that under the cap of workplace violence. But that sure is a workplace imbalance, work-related life imbalance. Those are stressors that we've got to deal with. And in the meantime, as your new helpers come aboard, give them a hand. They've passed their NCLEX, and even I remember the challenge of the NCLEX. And I was always a good student, and so I didn't have a thought about not passing. But it was difficult, and it still is and will be. It is the benchmark to your success in completing your education for your career as a professional nurse. So, I'm giving you virtual hugs. We will see you soon on Power Time. We may be off next weekend, but we will be thinking of you as June is here, and we will be welcoming our new graduates to their orientation as they start their career as nurses. And each and every day, be kind to those you serve each and every time, and welcome the new nurses to their new season, and do what you can to promote the profession of nursing. We need each other. We need each other each and every day. Nursing is a family. We need each other to make this thing work. and to keep us all strong, healthy, and encouraged to continue the work that we love. So I'll say thank you for tuning in. This is Sharon Herbert, the Power RN at Power in Nursing. Be well and love yourself because you've got to. You've got to take care of yourself first. And as we always say, sharing is caring. So share your love with others as well. Thank you so much. And remember, you can find us on Facebook, LinkedIn, Instagram, and Twitter. And we're going to talk very soon about happiness in nursing. That should be interesting. And don't forget, it's time to power up to your greatness. So, powering up and finding your happiness. Thank you so, so much. And share your caring with a friend. Bye bye now.